Yeah, I'm Steve Gallay. I'm a shoulder surgeon, orthopedic surgeon. I've been doing this for about 25 years, and one of the co-founders of Durham Bone Joint. And again, we're a regional-based approach to musculoskeletal care. And my background is not only orthopedic surgery, but also I'm a health system expert. Trained recently in Boston and Harvard doing healthcare management, the masters, and have a huge interest in value-based healthcare. We've tried to implement as much of value-based healthcare into our Durham Bone and Joint program, and that's where nutrition definitely takes a part of that as well. The reason I personally took an interest in perioperative nutrition, again, thinking, there's all that last mile in orthopedics or everything. Why do patients not get past 85% success? What's that last 15%? Mental health problems that need to be optimized, nutrition needs to optimize their black boxes. And so the idea is to try to normalize patients beyond what otherwise you can. So you can have the best diagnosis, concise, you can do the right imaging, get them the right time frame, but nutrition's a black box. So patients are still coming to surgery probably with nutrition that's all over the place. And it's very hard to know which patient is which, and so the best way to do it is just normalize them, provide them with perioperative nutrition. And so ERAS, right, Enhanced Recovery After Surgery, really took off in the last 5 to 10 years, and this sort of space has been taking off at the same time. Makes sense. Perioperative nutrition, perioperative management of the patient, so optimizing outcomes, reducing infection rates. And that's sort of, and I was aware of MEND probably through my colleague in HSS, Bob Marks, close colleague, and we've been monitoring and following the progress of MEND for years. And then it just got to the point where our population management piece really got to a critical point where we've got a good mass, economies of scale, great team, and thought now's the time to bring nutrition in. So basically started to get in touch with your team, started to work together, and met everybody, and now started to implement MEND. We actually brought in a product from Europe, and the problem at the time were very sparse studies. It was a really low quality studies at the time, and that product from a large company, everybody would know the company, the studies just really haven't gotten anywhere. And it may be because it was brought to Canada, it just was maybe with the wrong group. We haven't had the interest by payers here. In the US, we have payers now interested in supporting nutrition, and this makes a huge difference. So the studies have really picked up. Your group, MEND has really done some substantial studies, has a good, great R&D team, PhDs, subspecialty interest, and so we're seeing some good data that we could actually hang our hats on, and then actually, explain that to patients very clearly, and then get involved in the next iteration of studies, right? And so I think that the current offering is great for repair surgery, so all the tendon repairs, major joint surgery, of course, whole body joints, so hip, knee, shoulder are the most common, and those are the cases that we focused on first. So in the office, the uptake is very substantial with the surgeon. They want to know, would we use it? So for me, I took MEND this morning because I'm an athlete, I cycle, whenever I do certain sport, I want to have that repairability and maintenance. So they want to know, would I use it for surgery? And our team, we've met your team, of course, we've had some pretty in-depth education, and every surgeon here would use it, right, for the case types we talked about. And so beyond that, then we actually have a preoperative, it's like a course, a 1-hour course. Patients come in with other patients, and it's nurse-led and team-led. And then it's another time to go through each of our key pieces, so not just nutrition, but other parts. But on the nutrition side, a nurse walks them through, again, what the product's supposed to do for them, and then the uptake. So I'd say that at least 50% from the beginning are now taking on the nutrition package. Patients have come back saying they really like it. They find the taste is actually really good. Actually, every one of our team members tried it. And I understand we may be coming up with another flavor, which would be really good because chocolate is clearly popular. I think that would make a difference. So patients are liking it, they're using it. We've had patients now come back and say they think, I've done some patients who had their other shoulder done without it and now done their opposite side with it. They feel, again, anecdotally, because we're not going on that data, we're going on the large population data, the studies, but they feel that they're having an easier recovery. again, we'll only know as our own data comes out. And then we're asking for, patients are actually coming back and asking if they can continue on with the nutrition beyond the 1 month. And so we have now patients coming back and taking it on, because recovery for rotator cuff repairs, still it's about a 3 to 6 month recovery. The bonding time of the tendon is longer than say a joint replacement. And so we're getting interest there as well.